Hi, I'm Clay Stamp. I'm your Emergency Services Director for Talbot County, and here we are with another segment of a community conversation around the coronavirus. I'm joined tonight with Dr. Frida Wildley, our health officer. We have Rabbi Peter Hyman, and we have Lisa Lee, who's a clinical social worker with For All Season, who works with me. Both of you have worked with me in handling crisis situations in Talbot County to bring comfort to people. So we've worked well together in the past. This one's a little different, right? Mm-hmm. So the reason we're here tonight is that we want to talk about and explore the impact this crisis is having on the community. And what are the things that we should look out for? And what are some of the things that people should think about and maybe do to manage day in and day out with this unknown period of time? So I'm going to pitch it to Rabbi Hyman first. You can start off.
Thanks, Clay. Sure. Well, this is an interesting dilemma that we find ourselves in. Certainly unusual, not in most people's experience. I've been on a number of conference calls nationally with various organizations. The first thing everybody has said on those calls is follow instructions. Listen to what the leadership is saying, and almost all the calls have been very positive. They said, whatever you think under normal circumstances, put it away, follow what's going on. We should be able to trust what's happening, and I believe that's correct. Politics notwithstanding, I think that's really, really wise. So people are urging all of us, given that this is so anomalous of a situation, to do what the experts are telling us.
Excellent.
And to be calm. And the other thing that I'm finding is that this is giving so many of us an opportunity to rethink the normal and provide creative options to what was heretofore not done. Just one quick example, and then I'll be quiet. But
we're good.
We started to live stream worship services, and we did that because we didn't want people coming together, sitting in the sanctuary. Although it's large enough, we could have had enough distance between folk, but we just felt it was safer. We started the live stream, and this is really funny, but we had over 300 people watching at our last week for Saturday morning services, and normally we just get 25 to 30.
Wow.
So I'm thinking about maybe we should do this more often.
There you go. So rethinking normal. I like that.
I think that's really important. Yeah. And trust that the leadership is doing the best they can, and that we have to support them and embrace them in that challenge.
Well, I can assure you that Talbot County is just a really special community, as you know, and the leadership is plugged in, and we're all doing the best we can, and we're getting good information. So, Rabbi, you represent Tackle.
Yes.
So you're representing more than just the Jewish faith.
Oh, absolutely. Tackle is the Talbot Association of Clergy and Laity. Our president is Reverend Sue Browning. Sue wasn't able to attend, but all the faith communities are really gearing up to be supportive, not only of their individual communities, but all of us as a group who really are going through some challenging, and if not challenging, certainly stunning realities at the moment.
I think it's fair to say that the gravity and the scale that this emerging infectious disease is presenting is forcing everybody to think.
Oh, absolutely, and we are all in this together.
Oh, that's right.
Nobody. It doesn't matter who you are, where you are. We are all in this together, and one of the things that we have to do as a united community, not just locally here, but across the country and even across the globe, is to recognize that that's part of both the solution as well as the challenge.
Well, thank you. Thank you, Rabbi.
Thank you.
I appreciate you being here, and I think it's important for our community, so thank you for taking your time.
Thanks for asking me, Clay.
And Lisa, we've worked together, and I've watched you amazingly stand in front of a crowd of people and just disarm them and engage them and allow them to feel and communicate. And I just have such respect for you. And I know that you are feeling this situation, and I know that you have some thoughts around it.
Yeah.
And I'd love for you just to take a minute and just talk about that.
Sure. So I'm grateful to be here, and I appreciate those kind words. And I've heard such lovely things from everyone already through these discussions, and absolutely appreciate the need to trust leadership, because there's hard decisions that need to be made, and sometimes we don't know all that goes into those difficult decisions. And then as a mental health person, of course, we're always asking, so our first conversation is, how are you feeling? We're often trying to carry, where people are at with the fear that comes up. And I appreciate when you guys were talking about balance, because there needs to be such balance in how we manage the fear that comes up, because anxiety and worry are normal parts of our character. It's when it becomes a little bit too much that it causes stress on our system. And so, whether it's with faith, a higher power, or if it's, looking outside or embracing the moment of being with a loved one, it's those moments in the here and now that help us to stay a little bit more grounded. And I think that those are important strategies that we can use to get through, stay a little bit more balanced, and then trusting in our leadership, because there's a lot of difficult things that I think, whether it's the government or small agencies like our non-for-profit have to make in these challenging times.
So Lisa, can you watch too much television? Can you listen to too much?
Mm-hmm.
Do you need to unplug sometimes when you're facing these type of crisis situations?
Yeah, I would absolutely say that that's important, and it reminds me a little bit of 9/11, where we had to really start to unplug from watching all the news and all that was coming in. It's important to be informed, but maybe limiting the resources or the sources of the information, and making sure that we're not hearing about it over and over. And I think what helps to contain the anxiety is getting that information, but then living in the here and now, the moment of here. How am I feeling? What am I experiencing? What am I seeing? And really embracing and having gratitude for those moments of little connection we can get. And I love that you did the online service, because that's what we need to do now, is we're able to use technology in a way. We're looking at telehealth for therapy, and so we're changing the way that we're doing things and becoming very creative. And my hope is that, when we see somebody, we can't necessarily shake hands or hug in the street. Right, we can elbow bump. But it's about the smile, it's about the eyes, it's about the posture that brings that I'm with you in this moment, right?
Right.
And so it's those simple things that allow us to stay connected now, rather than maybe the embrace we used to do before.
Social distancing is not being antisocial in this case.
Right,
there you go.
And I think that's
and
really
we're
important.
distancing here a little bit, right?
Absolutely.
So people sometimes say, "Hey, look how close they are," but we got some space here.
No, but I think that's really important to communicate. Social distancing at this point in time is not a negative, but a positive, being done to protect all of us. It doesn't mean I don't like you. It doesn't mean I don't want to hug you. When it gets safe, I'll give everybody a hug. But for the moment, we need to really take that into consideration to protect ourselves and everybody else.
And I'm sure Lisa would say that we've been concerned about our seniors for some time, wanting them to get together, wanting them to socialize. They have a higher incidence of depression if they're not socializing. So I'm grateful that you live stream, because they still can see their friends and neighbors.
That's correct.
And feel not quite so disconnected.
That's correct.
And we're saying you might not go over, but you sure can call them up and ask them how they're doing.
Which is important, because individuals do have to have things to look forward to.
Yes.
Yeah, but they can do that in a different way. I mean, just beaming into the service, right? Or it's just a new normal, a new way of thinking.
That's exactly
right?
correct. That's exactly correct. It's taking utilizing the options that we have to respond to what is really a crazy reality at the moment.
Absolutely. Dr. Wadley, you are our head of public health, and that encompasses a great deal. And part of that is, behavioral health, mental wellness, I should say. And we've had a little conversation here. I'm just going to pitch it to you for some closing remarks. And, what are your thoughts around what we talked about?
Well, we started talking about fear, and then we started discussing the social distancing and why that's important, okay? But also what we can do for each other. And I really am concerned about the mental health of individuals when we start talking about stay away from crowds and stay away from people. So this is a very important part. The faith community, our mental health providers, they're just another two groups in this to help us get through this and be better off for it.
Thank you, Dr. Wadley. We always hear that when you're in crisis situations, you take one day at a time. You take little bites and just move forward. And then, I like to end these things by saying, please be kind to each other. And remember that we don't know when the end of this is going to be, but we know that if we take one day at a time, we're kind to each other, we lend a helping hand, we engage and embrace and do what we need to do to get through it. We will get through it. And I just want to thank everybody for joining us tonight and talking about this. And this is just one more segment on, carrying out a conversation about the coronavirus, and we'll have more if the public likes them.
Can I make one more?
You can.
Sorry. I've called my entire congregation. And that phone call, especially from the elderly, was really important because it said to them, somebody's thinking about me, I'm not alone. And that's part of what you just said about being kind to those. So use the telephone and call.
We often say that things like this can bring out the best in people. And history shows that sometimes it can bring out the worst in people. So let's try to bring out the best. It's a lot better.
You betcha.
And that's a great way to end this. So thank you very much, and that concludes this segment on having a community conversation about the coronavirus. Thank you again for joining.